Alrighty, well, welcome everyone. Happy Friday. Hopefully, up in the Bay Area, it's raining cats and dogs.
Yes.
So, but we will get started in just a second.
Hello, everyone, and welcome to today's session. We are PreMed CC, a student-led organization established in the fall of 2021. Our goal as an organization was to create an online community for pre-medical students at community colleges and universities with the hope of guiding the next generation of diverse and inclusive physicians.
And while we advertise our organization as being for community college students, our events are open to anyone. We realize that finding guidance and mentorship in a pre-med journey can be especially challenging for first-generation pre-med students, people that lack the financial resources, or just those that do not know people in the medical field.
One of the best parts about our events is that they are virtual, so you can do it from the comfort of your own home. We typically have events on Fridays from 5 p.m. to 6 p.m. PST, and on Saturdays from 10 a.m. to 11:30 a.m. PST.
If you aren't able to attend the event, all our sessions are uploaded on our YouTube channel. Many of our sessions will end with Q&A with our speakers. Any questions that you have can be put in the Q&A section on Zoom, and our team members will read them and have them answered.
After you have attended our event, you can log on to our website and complete the quiz, which will contain questions pertaining to our session today.
If you score 70% or higher on the quiz, you'll be awarded a 2-hour mentorship certificate to show that you attended our session today.
If you want to stay connected with our upcoming events or want to tell your pre-med friends about PreMed CC, you can find us on Facebook, YouTube, Instagram, and TikTok at PreMed CC.
Okay, so allow me to introduce Derric. So Derric Bynum joined Berkeley Public Health in August 2023. Derric has worked in higher education for over 10 years, with 8 of those working in admissions and recruitment. His love of working in higher education came from interacting with, supporting, and inspiring students to pursue and persist in their educational journeys. He personally understands that the road to and through students' educational journey can oftentimes be difficult, and the support that students receive along the way can make or break students' experience and sense of belonging during their time as a student. He earned his MA in higher education and student affairs from the University of San Francisco and received BAs in both sociology and African American studies from UC Davis. Derric is also a Bay Area native, born and raised in San Jose, California.
Thank you, Edith. And once again, I just wanted to say hello, good evening, welcome to everybody. Thank you for taking the time out of your Friday evenings. I know we're here in the Bay Area. I don't know how many folks are here in the Bay Area, but we're in the San Francisco Bay Area. It is raining cats and dogs right now. So, and hopefully the weather is not too crazy where everybody else is. But I just wanted to take the time again to thank you all for um, being here. I really enjoy um, being able to connect with students, you know, and hear their stories and really just work with them on their educational excuse me, their educational journey. Um, what I wanted to do is I'm actually going to share my screen and make sure that I have the right. Ooh, let's see. Ooh, okay. Make sure I have the right slides and the right screen and that it goes into the presentation format. Give me 1 second. Here we go. This should be it. Okay, so I am going to share my screen with everybody. Hopefully you all can see the presentation. Give me a thumbs up if you can see it. Awesome. Thank you. Thank you. So I wanted to just kind of provide a little bit of a overview of what we're going to, I guess you could say, cover and what we're going to talk about in this time that we have together. I First, I want to, well, there's one thing I want to do, and like I said earlier, I think that folks stories are super important. I think our own personal stories and biographies and histories and experiences, kind of give life to each of our paths and our goals, because we all can have, two people can have, the goal of being a doctor or a psychiatrist or a dentist or a statistician or what have you, and they can have the same goal, but the path to that goal can be wildly different based off of who we are, where we are, and what we encounter along the way. So I wanted to just kind of go over what we're going to cover first, and then we can just kind of jump into it. So um, first, during our time together, we're going to be covering, just what public health is, and why UC Berkeley Public Health, or I should say why Berkeley Public Health, for anyone that's interested in pursuing a master's or a doctoral degree in public health. I think, working at Berkeley, I kind of would be remiss if I didn't encourage people to take a look and consider Berkeley School of Public Health as an option. But also, in addition to that, we're going to go over, obviously the public health concentrations and programs that we offer, or I should say the different concentrations that are offered and the careers that are out there within the realm of public health. And then what UC Berkeley School of Public Health offers in terms of degrees and concentrations. And then if you're interested in applying, then we'll take a look at what that timeline and what that admissions process looks like, what application materials would be needed. And then obviously we'll talk very briefly on tuition, fees, and funding opportunities for students. Excuse me. And then we'll finish up with some Q&A, okay? Before we get into any of the, I like to call, the nuts and bolts of it all, just for those of you who may be jumping in a little bit after we started, my name is Derric Bynum. My pronouns are he, him, and his, and I am the Director of In-Residence Admissions and Recruitment at UC Berkeley School of Public Health. And like I said, just a minute ago, I think that sharing our stories and who we are and how we came to be, or where we are and how that affects where we're going is important. I think stories and biography and experiences, sharing all those, can make all the difference in the world when we're talking about and when we're on our journeys, whether it's professional, educational, what have you. And I'm not going to talk too much about myself, but I do feel it important to share my story. So like Edith mentioned, I was born and raised here in the Bay Area. I'm from San Jose. I grew up and was a student in the Eastside Union High School district. It's kind of like in, I would say, southeast San Jose. Growing up, I loved comic books. I was a big kind of nerd, so I was always into comic books and video games and everything. And I thought I was going to be, a doctor. I thought I was going to be a medical doctor. That was kind of like what was in my head and what was really. Let me go back. I would say it was in my head because I kind of was, under the impression that in order to be a success in this world, you have to be like a doctor or a lawyer. Now, being a kid, I had never, thankfully, had any experiences with lawyers, so I didn't know much about that world. But I had been to the doctor a bunch of times, and I knew that, at that point, I knew that doctors wore big white coats. They listened to your heartbeat. They gave you medicine. Sometimes it was disgusting. Sometimes it tasted really good, but it always made you feel better. I know that you got a sticker and a lollipop after every time that you went to the doctor. And I knew that they had very clean hands, and that was my idea of a doctor. And so as a kid, I felt like, oh, this is something that I want to do when I grow up. I want to be a doctor. I want to help people. I want to make people feel better when they're not feeling so great. And so, throughout school, I studied, I got good grades. Math was one of those subjects that really, really kind of made me work for my good grades. So as I got into junior high and high school, I started noticing the math started getting like, the math started mathing. It really started giving me a run for my money. But somehow, some way, I was always able to utilize the resources that were available to me, go to tutoring, and I was able to kind of do what I need to do in terms of getting those good grades, so that when time came for me to apply to college, you know, I was I was okay. I was able to apply and be somewhat of a strong student. I ended up graduating from high school and being accepted to UC Davis, going to UC Davis, which was a huge research institution, but also it was well known for folks who wanted to go into the medical field, as a lot of UCs are. Berkeley, LA, Davis was also one of those. So I figured, okay, I got into Davis, so I'm a step closer to my goal of being a doctor. I declared myself a biological sciences major, and I started in the fall. Um, I almost said what year it is. I don't care. I'm fine. I will go ahead and say the year. I started in the fall. I think it was like 2005. So I know a lot of people are going to be like, whoa, so long ago. For me, that was long ago now that I say it out loud. But, as I started, you know, in my curriculum, in my coursework, it was like, whoa, it was a different world. It was a different ball game. It was a real challenge. And as I started going further and further in my coursework, it was more of a test of determination to really not only to be successful, but to just survive in those college courses, in being, pre-med in my mind. One thing I noticed, and one thing that was really, really um, I think that was a saving grace for me, was luckily I was part of a program called Educational Opportunity, which is EOP, which did a lot to kind of help and retain students, especially from underrepresented and disadvantaged backgrounds. So that really, really helped me to survive in my courses, biology, chemistry. Once I got to OChem, though, I started, really, really considering some life decisions, because, as a lot of people may or may not know, but I'm sure do know, OChem is oftentimes called like the great filter, and let me just say, before I'm kind of going out of sequence, but let me just say, OChem was the one class that made me. I never thought I could be so happy to get a C in my life. So once I took OChem and I passed with a C, I celebrated as if I had won the lottery and went to Disneyland all in the same day. But I'm saying all that to kind of bring it back to, and there, I promise there's a point into everything I'm saying. So after that, I went to my guidance counselor and my advisor, and they said, they talked me through my courses and everything, and at that time they pointed out, hey, are you aware that you've been taking sociology, one sociology course almost every quarter since you've been here? This was my sophomore year, my second year, and I hadn't noticed. And it was just like, I didn't notice. I was taking this class because I like the subject matter and I want to keep continuing to take it. And they said, well, have you considered this as a major? And I, stopped and looked and said no. And they said, well, think about it. And so on my bike ride home, because in Davis there's nothing but a whole bunch of bikes, everyone's on bikes, I was thinking about it. And then so what I did was I stopped by the letters and science department, went to the sociology department, and looked at and got the flyer for the sociology major, and what prereqs I need to take to officially declare being a social major. So fast forward into my second year, I take the courses and I officially go from being a biological sciences major who was pretty dead set and sure that they were going to be a doctor, to a sociology major and not quite sure what that means for my career, my future, because I don't know what sociologists really do. So I had to do a little bit of research. And over time, over the last half of my college career, I found that, sociologists can kind of do a little bit of everything, or they can do many things. But I went through that whole experience and figured out what I wanted to do, which was work in higher education, because I was a peer counselor for the EOP program that I came in as. I also worked as a peer counselor for, and a lot of it ended up being sort of an advisor and a mentor to my peers, so younger students who were coming into the university, and working with them to make sure that they were able to kind of navigate that whole educational and college system, and educational and higher education journey. And like I said, I promise there's a point to all this. So fast forward, 10 years or so, or 10, 15, 10, whatever, 10, 15. I told you math wasn't always my strongest suit. And I am or I should say, I've been working in higher education. I've been working as a student services advisor. I've worked as a admissions counselor, and I decided to go back and get my master's degree. And I just recently finished my master's degree in higher education and student affairs. And I find, UC Berkeley, School of Public Health, and I look into it, before I apply. I do my research, look into the school, look into the program, look into everything. And I find out, well, first of all, I said, well, what is public health? Because prior to UC Berkeley, I had worked at a private university that it was a healthcare private university. So basically, it was a school for folks who wanted to go into healthcare as nurses, occupational therapists, physical therapists, physician's assistants, things like that. And so I had been in that world of working at a healthcare university for almost a decade, and seeing healthcare, I see that it's a very kind of individual. It's on the individual level of folks helping people, And I look into public health and I say, well, okay, well, that's, healthcare, being a nurse, being a doctor, that's, one thing, but what is public health? And so as I research, I find that public health is more, well, let me stop right there because I'm getting ahead of myself. So that's how I found myself working here at UC Berkeley School of Public Health. Now, I don't want to get too much ahead of myself, but now is the time where I kind of come out of talking about me and talk to all of you and really get interactive. So before we get going, on our next slide, I want to ask you all, I'm assuming everybody kind of knows, but I might be wrong in my assumption. So I want you all to put in the chat. I asked the question, I proposed the question to you: what is public health? What do you know about it? What is it? And so if you know, go ahead and post in the chat, and we'll discuss it in about maybe, let's see, we'll give it like 30, 45 seconds. And then I want you all participants that are here to post in the chat or in the discussion, what is public health to you? What do you think it is? What do you understand it to be? Okay. And you don't have to be shy. All right, so we got some folks chiming in. I see, what is public health? To the question, what is public health? Community health. He says public health is about focusing on community health rather than individual health. Okay. Health as a collective via the community or for a community. Okay, including different programs and educational services. Okay, we got some like just. Have you guys been have anyone here been on Jeopardy? Because I feel like everyone here is just like just streets ahead in terms of like knowing what this is. It makes me feel bad because I was just like when I first found out, I was like, what is public health? It seems like pretty self-explanatory, but I didn't know what it was. But because I know what it is now and seeing all of your responses, I'm just like, y'all are y'all are smart. We got a smart bunch here. Health as a class, I'll say a field that works to support community health. Community health, yes, I'm seeing a very prevalent theme of community. Mhm. Public health protects and improves the health of entire communities. Yes, community and population level health. Ooh, that's a good one. So there is not one. Let me just say to everybody, I have not seen one incorrect or far off response to this question. So you are batting very high in this as far as this goes right now. You all are basically right on the money. Okay, so what is public health? If we look at what it is, and this is according to the Association of Public Health of America. I'm sorry, the American Public Health Association. Public health promotes and protects the health of all people and their communities. Okay. And so when I started seeing community, and that reoccurring theme and term community in the chat, I was just like, yep, everybody knows, everybody's on the money, everybody knows what time it is. Everybody's right there. And I wanted to kind of bring it back to something I was discussing earlier, which was my previous understanding of health and healthcare and how it relates to public health. Now, mind you, I mentioned that before working here in UC Berkeley School of Public Health, I had worked at a private healthcare university. And so to me, up until really like recently, um, I think the dominant thought of what health was and how health looks in terms of how it looks, to do health or be part of healthcare. I think I was coming from a place of, the traditional healthcare, which really kind of comes down to, the healthcare industry and how it treats people who are sick with, as on an individual basis. Okay. Whereas public health aims to prevent people from getting sick or injured in the first place. That's kind of like the basis of it all. Public health, looks at and focuses on entire populations, while healthcare itself focuses on individuals, basically just individuals. Now, as I've come to working closely I should say closely to public health, parallel to public health within a public health school, I'm a person that loves to kind of, you know, filter down and get to like the root, the essence of things. And to me, public health is just what happens when you mix prevention and populations. That's kind of what it all boils down to for me. And once I figured that out, once I kind of boiled it and filtered it down to that, it's like, oh, and then when you figure that out, the whole world kind of opens up and you start to see where public health, makes its place in, in society, and where careers come out of that. And it's pretty huge, actually. It can be on a very small scale, but it could also be on a huge grand scale as well. And so I think that everybody here is right on the money in terms of knowing what public health is. Okay. Now, when it comes to public health in society and the career paths that come from it, I wanted to ask you all, I want to have you all take a look at the images that are on the screen right now. Okay. It's kind of, some of them are kind of, they could be kind of, like I said, it goes from macro, big scale to kind of individual, and they're kind of all over the place, So, when you take a look at the images on the screen, what do we see? We see you know, some reproductive health items. You know, we see contraceptives. We see a couple of signs. You know, we see that one sign that is the seat belt sign, you know, letting us know to put on our seat belts or click it. You know, oftentimes we see those little signs on the freeway, those marquee signs that say like click it or ticket. What else do we see? We see a no smoking sign. You know, we see a industrial plant that probably looks like there's some most likely, if anything, there's some pollution coming up from that plant. You know, what else do we see? We see just a normal ordinary salad with cherry tomatoes, which by the way are my favorite tomatoes. For some reason I don't like tomatoes, but I like cherry tomatoes, so that might be subconsciously why I picked that picture. What else do we see? We see a can of, it looks like, I'm guessing, soda, I'm guessing 7-Up. And then, but specifically, we see the nutrition facts on there. And then I'm just kind of going, you know, clockwise. And then the last image we see is of an older individual who's not only masked up, they have their mask, but they're also getting some type of inoculation. And we see a healthcare worker who's administering that to them. Okay, so I'm gonna ask everybody else one more time to get interactive. We'll put on our interactive caps and get into interactive mode. What do all these images have in common, and or what link to public health do they, in your mind, do they have to you, or what do they mean to you? So we'll allow for about a minute or so to have folks, all the participants, be able to interact and respond in the chat. Okay. Okay, we got a couple folks who are chiming in. So we have social determinants of health. Okay, they're all linked to health, and some are positive and some are negative. Annotations of the overall idea of health. Okay, they all work towards promoting good health and preventing illnesses and injuries. Okay, that's a good one. None of these are wrong, by the way. Just want to let you know, none of these are wrong. These are all good responses. Advice or recommendation for general public health. Okay, again, not one incorrect or wrong or far off answer has been submitted. These are all right on the money. Okay, we're gonna give about 30 more seconds, and then we're gonna go ahead and proceed. They can improve quality of life. Okay, okay. Again, everybody that has submitted a response in the chat is right on the money. Again, no one is incorrect. No one is far off. You all are basically right there. So 30 seconds is up. So we're going to go ahead and proceed. So basically everything that you see here in this slide, all the images basically are kind of visual representations of public health and what a public health can and does lead to. Okay, so I use the photo, the image of the contraceptives as well as the I mean, they can all kind of be, you know, linked to anything within public health. There's a big conversation to be had. But in the way of the photo of the contraceptives, I look at that as kind of representative of sexual and reproductive behaviors and how that factors into public health and what effects that has on communities on a micro and macro level, you know. So you know, if we kind of take that and look at, um, like take a look at just the contraceptives themselves and how they have been around, but there was a big push for them, say in the especially in the uh, 1980s and 90s after the HIV and AIDS epidemic started to come into the world and be introduced, and folks became really, really aware. Then that started changing the behaviors of people. Whereas before that time period, maybe folks maybe weren't utilizing these items as much, in response to certain things happening, public behaviors started changing. And also the information and I guess you could say public, I don't want to say policy, but we'll get into that in a minute. But behaviors of the public and communities began to change as a result of a public health issue. And so this became a method of prevention, for folks, you know, this became a method of prevention for um, the AIDS and HIV epidemic at that time. Okay. Now, if we move into, the click it or ticket or the seatbelt sign, we've all seen those ads. We've all seen those little marquees on the freeway. And hopefully, if you're lucky, you haven't ever had a, a ticket, what are they called? They're tickets, but you never had a traffic ticket for not wearing your seatbelt. Okay. Luckily, I have never had a traffic ticket for not wearing my seatbelt. I've had one for going in the commuter lane when I wasn't supposed to, but I've always worn my seatbelt. So I like to, have that. I like to rock and wear that as a flex, as a pin, a badge of honor. I've always worn my seatbelt. But if you look at seatbelts, they're something that most of us has probably grown up with and known our whole lives, based on and depending on the model of car, model of automobile that you have ridden in. Okay, but the having seatbelts be a requirement and be a law goes into policy or health and policy and management. So that kind of goes, when I say policy, that goes on the macro level. When you look at, certain things becoming laws and being enforced, that's policy. And that's kind of I guess you could say, an example of public health being integrated within policy and lawmaking. Okay. Same thing can be said for, the soda can with the nutritional facts on there. Before, I think it was 1994, there wasn't any type of requirement for foods and beverages to have nutritional facts and nutritional labels on their packaging. Okay, but just within the last 30 years, it's something that has become part of policy and law. So public health, that's another example of public health and how it affects our society and how it kind of comes into our lives and is a result of the things that are going on around us. Okay, you see you see the no smoking sign. That's also kind of a example of like public policy or health policy. Certain buildings and things you can't smoke within, like inside or within like 20 feet of a building. That's an example of like public policy. and health policy management. Okay, if you look at the image of, excuse me, of that big industrial smokestack, that kind of links into environmental health, environmental health sciences and global health, global and environmental health, which are also part of public health. Okay, which also key into public health on a macro level. Okay, so if you take that macro level, you can kind of go down and filter it down to more of a micro level. I included the image of the salad just to kind of show one or two things. One being behavior. Public health can come in the ways that we do things such as what we eat and what we have a habit of eating and what's within our communities in terms of available food and health choices when it comes to food. I don't know if anyone here is familiar or has heard the term of a food desert, but that kind of relates and connects to the idea of within a certain community or within a certain geography, if there's no healthy, or I should say, if majority of the health and food options in a certain area or vicinity are, fast food or junk food or, food that's kind of has a lot of, I would like to say, things that are not pronounced, that are hard to pronounce, that typically tends to let you know that you're in a food desert. If you're in a place where you can't find any type of fresh produce or organic foods or fruits and vegetables, if you can't find any of those things, then you're probably in a food desert, which kind of comes to I would say a larger conversation of public health, but also it does kind of filter back into behaviors and how we choose to, and what we choose to do and how we choose to do it. So I love a good cheeseburger. I love cheeseburgers, but I can't eat them every day. Especially as I get older, I can eat them less and less because it's not healthy for you. And so I have to know to alter my behaviors and make sure that I am taking my health and nutrition into consideration. Okay. Now we look at public health. The I guess you could say the topic in the area of public health nutrition comes into play, and that's how it links in back into public health. As I mentioned before, that concept of food deserts and healthy and nutritious availability within certain areas and demographics and populations and locations and geographies, that kind of goes into public health nutrition, which links back into obviously public health as a whole. And then the last image, there's a lot that can be, taken from that image as well. There's epidemiology, which is a part of public health, the study of sicknesses and illnesses and germs. There's infectious diseases and virology, which is also the study of, I would say the most prominent example being the pandemic, which we are just kind of now coming off the tail end of. It's funny, back in 2021, 2022, I would hear people say, oh, the pandemic is over, we're out of the pandemic. I'm just like, no, we're still very much in it. So that occurred in 2020, and so 4 years later, we're just now coming out and coming off of a global pandemic. And so during that time, behaviors such as wearing a mask, enforcing and participating in social distancing, things like that, having folks that were able to receive the, vaccinations, those all kind of also tie into public health as well. Just the idea and the concept of a vaccination to help prevent the spread of COVID-19 is almost like the very definition, or one of a very, very poignant and very, very, encompassing and prime definition of public health, which is prevention of illnesses and I guess you could say sicknesses and illnesses on a population level. When you look at that, that basically kind of comes into and encompasses the idea of public health. Okay, so public health is not any one thing. It definitely has different, I guess you could say, different looks, and it has different places within our everyday world in our societies. It can affect us on a almost, on a very small individual level within our communities, such as, a neighborhood or a block, a neighborhood, a city. And then it can also, affect us on a global setting or a macro setting, such as, a worldwide pandemic or things like that, or, the effects of pollution. If you look at if you want to take a look at another really, really poignant example is the water situation in Flint, Michigan. How folks in that area are still looking and trying to figure out how to get clean water, clean drinking water, and that's definitely a public health issue. So these images are just kind of little examples of the bigger kind of picture and the bigger concept of public health that I wanted to share with you. Okay. And so this kind of goes into what we we're just already talking about. Careers in public health, or I should say careers in public health, have different looks. It's not any one thing. It's not one size fits all. People from restaurant inspectors to epidemiologists to biostatisticians. I can't say that. It's late. It's Friday. Biostatisticians. There, I got it. Health educators, policymakers, social workers, nutritionists, community health workers, first responders. All of these careers, all of these are kind of under the umbrella of the type of professionals that you can find that work within public health and that have that might have gone and received a degree, be it as a master, a bachelor's, a master's, or even a doctoral degree in the field of public health. Okay, so there's never any one thing that's in this field or any one thing that's attributed to this field. This field has so many levels and so many different options and opportunities for people to be a part of the field of public health. Okay, so if we look at Berkeley Public Health, I just kind of wanted to take this time to kind of highlight, Berkeley, what makes Berkeley Public Health Berkeley Public Health. And so what we believe is health as a right for everybody. And we look at, how social justice is linked to health and the right of basic human right to a healthy life. Okay. We look at strength through diversity, as the world, as we kind of go forward and as time moves on, the world is kind of getting smaller. I think, with the advent of not just television, but now the internet and social media, we as individuals and as communities are able to we can go beyond our neighborhood, we can go beyond our block, we can go beyond our city, and we can see what's going on in the world a lot more, a lot easier than it was to do so, 20, 30, even 20 years ago. Like I said, the world maybe physically hasn't gotten smaller, but I would say digitally has, with the advent of the internet and social media, that has kind of digitally made the world smaller and able to kind of, peer into, the global backyard, so to speak, and see what's going on in other parts of the world that, we might not necessarily know or hear much of, in our newspapers or our, local news or even cable news, so we do look at that, and because of that, we recognize the importance of diversity in education, service, and research. Okay, because again, when you look at health and everything, it's not a one size fits all, and the more diverse and the more perspectives and experiences that can be drawn from, the more can go to actually contribute and contribute and help health and public health on a public health and on a global scale. Okay. Thinking forward and innovation is also very much a part of kind of the mission of Berkeley Public Health, faculty and students. Cultural changes, conventional thinking, technology, all those are kind of used to build bridges between research, policy, and education, action, and prevention, to really make huge strides in order to increase and improve public health on not only the local, but also the global level. Okay. And in addition to that, there's a strong commitment to having a maximum and positive impact by focusing on research, education, and service, especially on all populations, but also the populations that might be a little bit disadvantaged and need it more so than others, or be in more immediate need of health and intervention than others. Okay. And so why Berkeley Public Health? Because there's a lot of public health institutions out there. So for those that are interested in public health and pursuing public health, why would one want to consider Berkeley Public Health as an option if you're looking at going and continuing your education, getting a degree in public health? Why Berkeley Public Health? Why? Well, first of all, student activism is kind of, I want to say, I've learned is in kind of the DNA of Berkeley Public Health, and not just Berkeley Public Health, but the UC Berkeley campus as a whole. Students are very, very politically involved and active, and I think that kind of that tends to run in a natural and parallel path with public health, because if you're for someone to work in public health, there's a high chance that there's an activist bone, at least one, within their body, because they're working towards some type of change on some level, be it within their community or in the global setting. Okay. There's the Diversity, Respect, Equity, Action, and Multiculturalism Office, which is acronym for DREAM. So our DREAM office is an office that is geared towards not only the recruitment of underserved and underrepresented populations, but also the retention of those populations. We have prospective student ambassadors, tutors, and retention specialists that are there specifically to work with and help ensure the success of those who are in the Berkeley Public Health programs, to not only work to get into the program and get admitted, but also to stay and finish and complete the program as well. Okay. As a school of public health, we are not tied to any medical school. Okay. So, Berkeley School of Public Health is kind of its own specific school with public health specifically and explicitly, or I should say exclusively, its interest, as opposed to being tied to a medical school. Okay. There's lots of hands-on experience within the classroom that comes from the lesson plans, that comes from the instructors, in terms of instructors being out, obviously being experts in their field, and bringing that field experience into the classrooms so that students can really not only learn about public health, but also see and do it as well. Okay. That term, that I guess you could say that theme of community is also very, very prevalent within Berkeley Public Health as well, because here in the Bay Area is, it's a lot of folks in a very little, um, bit of land and square footage. It's dense. It's what's the word I'm thinking of? It's a dense population. It's very dense in a very small area of land. And so there's lots of obviously people, but within those people, obviously there's communities. And on Berkeley's campus, it's a very, very, I would say, tight-knit community of students. I work in the student services office. And so it's funny, part of me is just like, wow, like I work in like, I know in many other institutions and universities and schools, a student services office probably just has, staff and faculty just working in, something of a suite or on a floor, and that's it. And there's a student services area that's separate from that. I can say I work in the student services area, and that is kind of integrated into the space for students. And so obviously we have our staff that we work with, but we see students walk in and out all the time. Every Wednesday there's like a soup. It's like a soup of the week that we serve every Wednesday. It's completely free for students, and that's not through the cafeteria. It's not through catering. It's not through any type of food service or anything. Those are just, administrators who are serving soup every Wednesday out of the kindness of their hearts. Okay. And I've been in this role. I'm relatively new to this role. I've been here for about 6 months. I've never seen anything like this at anywhere else that I've ever been as a student or as a staff member, and so I think that just having that community really kind of reinforces the idea that holds up, or that's at the root of public health, which is population, but more specifically community, building that sense of community so that, the drive and the inspiration and motivation to want to work with and be a positive change and help different communities, or the communities that we live in. I think that kind of helps to exemplify that. And so I just wanted to kind of say that, because I've been in a number of institutions that I've never seen a student services office do that. Okay. We have career services. Okay. So we not only do students, go to class, not only do they study in the student services area, not only do they build community, but there's also career services to help them work, and I should say to work and to find work within their field, while they're in the program and shortly thereafter. Okay. We have classes both online and on ground. So I am the director of residential admissions and recruitment, which means I work with students who are applying, who are looking at and interested in the Berkeley School of Public Health. And the residential aspect means that I work with students who want to come on campus to the program and be a part. Now, we do have an online only Masters of Public Health program. And even in the online modality, I think that, folks who choose the online option, they're on ground like 10% of the time, and 90% of the time is online. Okay. Oftentimes, folks that are interested in earning their public health degree, it's kind of a personal choice. Some people might, be local, and they like to have, and they're able to be in the classroom to learn and to, connect with their cohort classmates and everything. And then there's some folks who may be, living out of the area. There might be some folks who live in the area, but they might have their own family, they might have other responsibilities that they have to tend to, and so they can't necessarily take advantage of the on-ground option, so they do the online. So, but I want to just point that out, that we have both modalities available for students who are looking to earn their master's in public health. Okay. We have interdisciplinary partnerships. So it's not only do we not only is it just Berkeley School of Public Health and only Berkeley School of Public Health, but there are other options as well. I know that we also offer concurrent degree programs with other schools on our campus. So we offer not only MPH programs, but we offer MPH / Masters of MSW, which are Masters of Social Work and Social Welfare. So folks can get their MSW / MPH, or people can come and earn their MPH and MCP, which is Masters of City Planning. There's also, excuse me, there's MPH and let's see, I think it's like the Masters of Journalism program. There's also the joint medical program that's a partnership between UC Berkeley and UCSF. Okay, so there's other options as well for folks that might be interested in a more of a disciplinary and an interdisciplinary curriculum. Okay, and again, there's high touch support. So like I mentioned, we have obviously our student services area, we have our program managers, we have also, in addition to that, we have tutors, public retention specialists, and we have prospective student PSAs, or prospective student ambassadors through the DREAM office, who work with students who are interested in pursuing their in pursuit of their public health degrees. Okay. Well, there we go. So I mentioned before, we have on-campus program offerings. So these are all of the concentrations and offerings that we have for folks who are interested in the public health degree on campus. Okay. As you can see, we offer our traditional 2-year Masters of Public Health. Okay. Our concentrations involve, or I should say include, epidemiology and biostatistics, environmental health sciences, global health and environment, health and social behavior, infectious diseases and vaccinology, public health nutrition, maternal, child, and adolescent health, and health and policy management. So everything that we were talking about just a minute ago with the images and what comes what comes to mind when people see those images and how it's connected to public health, all of those concentrations, all those areas are offered here at Berkeley Public Health within our concentrations. Okay, so for folks who are interested in the traditional 2-year MPH, we have those concentrations. Okay, in addition to that, we also have an 11-month master's. It's an accelerated 11-month master's of public health degree in the areas of epidemiology, public health nutrition, maternal, child, and adolescent health, health policy and management, and interdisciplinary. Okay. The 4+1 program is very unique. The 4+1 program is for UC Berkeley students who happen to be Berkeley students. And then once they're basically done with their bachelor's degree, they apply to our 4+1 program, which will kind of feed them right into their MPH program. So it's 4 years and then 1 year, and then they come out with their Masters of Public Health in either epidemiology and biostatistics, public health nutrition, or maternal and child and adolescent health programs. Okay. And then there's also the Doctorate of Public Health, which is our DRPH program. And then there's our PhD program in biostatistics, epidemiology, environmental health sciences, health policy, and infectious diseases and immunity. Okay. Now, I mentioned before that we also have concurrent degrees. So there's the Master's of Public Policy, Master of Journalism, Master of City Planning, Master of Social Welfare, and the Masters of Business Administration. All of those are concurrent degree programs. So you would not only receive your MPH degree, but also it's like a slash. It's like MPH slash, and then the other master's degree program. Okay, and we also offer Masters of Arts and Masters of Sciences. And then I mentioned the joint program. So there's the MS and MD program with UC Berkeley and UCSF. And most of those joint programs are through UCSF. I think we do have an MD with, actually, I'm not sure if we still have the MD and MPH with Stanford. I think I need to double check on that. But these are the programs that are offered on ground for anyone interested in Berkeley School of Public Health. Okay. Okay, and like I said, I already went through these earlier, but these are the concentrations for the that we offer within the Berkeley School of Public Health. Okay, and I think I kind of got ahead of myself in listing the concurrent degree programs that are offered as well. Okay. Now, we also do have specialty areas, which are kind of like minors to your program, that are certificate in food systems, global health, graduate certificate in health management, as well as a grad certificate in racism, health, and social justice. Okay. So those were our on-ground offerings. And then we also have an online MPH where students can look at these concentrations that are listed here, which are epidemiology, biostatistics, health policy and management, public health nutrition, and the interdisciplinary track, as well as the community health sciences, global health, and spatial data science programs. Okay. We also have a grad certificate in health management, but it's only available for current students that are already enrolled at Berkeley. So we may be able to accommodate public health interests that are not listed, but for more information on that, you would need to make sure to visit online mph.berkeley.edu and view our course catalog. Okay. So the excuse me. So the typical program design is viewed as 42 units with 27 months long, so about 2 years. And the type of degree that is awarded is the MPH. Now, this is for the online program. I just want to make sure to clarify. And like I said before, the online program is about 90% online and 10% in person. Usually those in-person hours, or that in-person component, is going to be during summertime, where your summertime visits are going to be about 2 in the summer. Okay. And then there's also a first year student campus visit, which is the 3rd week of June. That's in the first year. And in the 2nd year, there's a visit at the end of May. Okay, for a couple of days. Okay. Now the courses for the online MPH are asynchronous, which means that students don't necessarily have to be all meeting at the same time. Students can work at the time of day that's most convenient for them, and they're not beholden to a specific day and or time. Okay, but students are expected to spend an average of about 15 to 17 hours per week on course assignments. Okay. Now, for anyone that's interested in applying to the program, there are admission requirements for both the in-residence and online programs. So typically, especially for the MPH and the Master's of Public Health degree, a bachelor's degree is required from a recognized equivalent from an accredited institution. We do have a grade point average minimum of about a 3.0. And it's going to be focused on work that's completed after the first 2 years of at a bachelor's degree program. Okay, so we definitely look for a B average. It's not super like strict or rigid. We have worked with and accepted some applicants who might have maybe 2.7 or 2.8 or 2.9. Okay, but in accepting those students, there's usually we work with those students. So I'll just put it this way. And this a staff member, a coworker, really put it in words that kind of like made me think and really brought it home, which was no one sneaks into Berkeley. No one kind of like there's no one that gets in by accident. There's no one that sneaks in. If for any and every student that applies and gets admitted to Berkeley, it's because they are a strong applicant. Now, being a strong applicant does not mean that every applicant has 4.0. Like I said, and it kind of goes back to the first couple minutes when we all kind of joined in, which was we all have a story. And all our stories are different. And some, folks on their educational and career journeys, it looks like a straight line. And some people, it's like zigzags, circles, and everything. So I say all that to say that, again, if a student applies to our program and if they're admitted, it's not because they got in by accident. It's something, they got something special to offer, and the faculty and review committee see that and acknowledge it. Okay. In addition to just, GPAs and grades and coursework, there is a certain level of undergraduate training that is taken into account to do grad work in your chosen area. Okay, there are individual program requirements for each program, or I should say for certain programs. So I encourage you all to visit those sections on the website. And then also for international students, usually passing the TOEFL or IELTS is a requirement. I think the score is about a 90 or better is the benchmark for students that have the IELTS or TOEFL requirement. In addition to all this, students that apply to our program need to make sure that they have all the required application materials when they submit their application. Okay, and that's usually listed on not only our website, but also the application when it comes time to apply. Okay. Now that's for the in-residence admission requirements. Now and here's just the checklist for other materials that are required for application. So for folks that apply to the MPH program and excuse me, for the MPH and also for the DRPH, I believe, there is the SOFES application, and there's the UC Berkeley grad app. So there are two separate ones, but usually what happens is when an applicant applies to SOFAS, their materials typically get migrated over from SOFAS also to the UC Berkeley grad app. So what should happen, and it definitely will happen, is if you as an applicant make sure that you uploaded all the required materials beforehand and thoroughly, then those materials should be taken from SOFAS and applied to the grad app fee or the grad application as well, because that's a kind of a separate application through the UC Berkeley Office of Graduate Division Office. Okay, so in addition to that, there's the resume, there's a statement of purpose, and the personal history statement. Those are two separate and different documents and parts of the application. What I like to say to students who are applying to the program is your statement of purpose is kind of saying why you want to pursue that specific educational concentration and what you're looking to not only get out of it but do with it. Okay, so kind of like you're stating your purpose, why you want to apply to this program, which is different than your personal history statement, which goes back to what I was talking about earlier, which is your story. Your personal history statement is really kind of the opportunity for you to tell your story. Okay, and we all have one, and all of our stories are different from everyone who's going for the same thing. And that's what the faculty and that's what the admissions review committee really kind of look at. They're going to look at your your GPA, your courses, your coursework, your statement of purpose, but they're also going to take a look at your story, your personal statement, because that's going to give them a much more detailed look at who you are and what you have to offer and the different experiences, the unique experiences that you have, and how you can contribute to the diversity of the program itself. Because like I said before, public health is, is only improved when there's diversity that's woven into it. Okay. So there's all those aspects, and then there's 3 letters of recommendation. Now they can be from, usually it's a great idea to get them from those letters of recommendation from instructors that not only, that can speak to you not only as a student, but also your traits, your positive traits that are going to serve you well within the realm of public health. Okay, so it could be, instructors that you've had and built up a great rapport with. It could be from folks that you worked closely with. So someone that is going to be able to speak not only highly but deeply of your traits and how they're going to serve you in your program, but also within the realm and industry of public health. Um, I always tell people, if someone is just writing a letter and telling how punctual you are, that's probably, not the, it's probably, it's great to be on time, but when reviewers see that, they're going to say, oh, you know, that's it. That's all that was written about, this person. So I don't really know if it's something that we can really, hang our hat on in offering admission to, versus someone who, has worked with you for, a year or two and seen your determination, seen your curiosity, seen, uh, you know, um, the way, I guess I want to say like the passion in which you pursue, um, you know, the goal of your role, but also in the greater kind of picture, how that is going to factor into serving, the industry of public health. And so those are really what faculty members are looking for in those letters of recommendation. So that's something you really want to make sure that you have when the time comes to apply. And then making sure that you have all of the official transcripts from every college that you've attended. As an admissions director, we see a lot of, well, not a lot, but we see more than we would expect, more applicants that apply and don't have their transcripts sent. And that's like a big issue. So if you're going to apply, make sure that you have all your transcripts included as well. They don't all have to necessarily be complete when you apply, meaning you don't always have to have your bachelor's degree like conferred to you when you submit your application, but it needs to show where you are and that you're going to be completing your bachelor's degree soon, or whichever program that you're currently in. Okay. And so applicants with the non-US and non-English or non-Canadian bachelor's degree must also submit the WES evaluation, as well as transcripts from that institution that you've completed, as well as the official TOEFL or IELTS scores, if applicable. Okay. Now for online MPH admission requirements, it's pretty much the same thing as the residential. Your bachelor's degree is required from an accredited institution. Some type of familiarity or training, especially in statistics or college level math, biological sciences, and social sciences. We really look for a grade of like a B or B plus or higher, or an international equivalent to that grade. Again, a minimum GPA of about a 3.0, and that's looking at usually your last 2 years of your bachelor's degree coursework, and then your transcripts from all of your institutions that you've attended. Okay. And again, this is a checklist for the online MPH program, which is very similar, very similar to the on-campus residential application as well. Okay. Preparing a strong application. Okay, so we already went through all of the application requirements, but I also want to highlight the importance of timing your application. So for the folks that are looking at potentially starting or attending the in-person on-ground public health programs, you just want to keep a note or keep a mark your calendars of this timeline. So typically the application becomes open in mid to late August. So for those of you that are looking at applying for a public health program for next year, which is going to be 2020, it's going to be 2024, 2025. That application should, at least for us, open up towards the middle or end of August. Okay. And so you'll want to mark your calendars for when that open. It just says August 16th because that's when it opened this year. It's not always the same exact date, but it usually is about the middle of August. Okay. And then after the SOFAST application opens, about a month later, our UC Berkeley grad application opens, and that's also going to be required. So typically what happens is you'll fill out your SOFAST application and submit that and pay for it. And once you submit your SOFAST application, then it'll automatically migrate your application materials to your UC Berkeley grad app, in which case you just pay for that application and you're done. You don't have to necessarily upload everything all over again. It'll just be automatically uploaded onto the UC Berkeley grad app. Okay, so that happens. So once the grad app is open in mid-September, folks will have about 2.5 months to get everything in and pay their application fees. We do have application fee waivers for domestic students, so I just wanted to point that out. Okay. But you also, but you really want to make sure that you circle on your calendar. I usually tell people circle the beginning December 1st as your application deadline, because typically our public health applications are due, within usually the first 4 to 5 days of December. It just kind of depends on our Office of Grad Div and when their specific deadline is, but I tell people just to be safe, circle December 1st, because that's typically not far. It's either that date or not far off from the date that your application is due. Okay. After you submit your application, hopefully you have all your materials submitted by then. But after you submit your application, as an institution, we select our admissions review committee, which is mostly composed of faculty. They review all the applications, and then usually around late February, early March is when, I should say, usually around early to mid-February is when we start sending out admissions decisions. And for certain programs like the interdisciplinary program, which is the 11-month MPH program, and the 11-month and 2-year public health and nutrition programs, they have actually a second application deadline as well. So there's a priority deadline for all programs, and then 2 programs have a second application deadline in case the first, in case applicants weren't able to get it in for the first priority deadline, and that's usually in early March. Okay. And so between, I would say, mid-February to mid-March is when applications decisions start to become released as to who we're going to admit, who are waitlistings, and who we will be denying for the programs. Okay. For the online program, it's almost similar, except their application deadline, their priority deadline is a little later. It's about a month after the December deadline for on-campus residential programs. Okay, so typically it's the end of the first week of January is the priority application deadline for those who are looking to do the online MPH programs. Okay, and again, I believe that the final application, so there's a priority and then there's the final application deadline that typically happens around the beginning of March for the online program. And then after mid-March is when this admissions decisions typically are released. Okay, and those are usually released mostly at the beginning of mid-March and the end of March, and then the last kind of outstanding decisions are sent out between April and May. Okay. Okay. So if you're looking, and it's a little early, we're about maybe 5 months before the applications are even open, 5 or 6 months. But if you're looking at applying to the program, you'll definitely want to make sure that you visit the Berkeley School of Public Health website, and check out our admissions requirements section for both the online and on-campus sections, and make sure you take note of the priority deadlines for both. And make sure you circle those, because that's going to be very important to make sure that you get all application materials in and submitted and your fees paid by the priority deadline. Okay. Transcripts, again, I want to just kind of reiterate that we do look for a 3.0 minimum GPA calculation, and that's typically for your last two, I guess to say last 2 years of your undergrad. Okay. You still should, and I should say, you still want to submit an application even if your GPA doesn't quite hit 3.0. Like I said before, we do have some folks who, they might come in at a 2.7, 2.8, 2.9, and we still work with them, and we still work with and reach out and communicate and really work with them to see what was the reason for those GPAs and how they can still contribute to the program if admitted. Okay. So definitely, if you fall into that category, still we encourage you to submit your application anyway. It's all going to be done through, typically it's going to be done through the SOFAS portal, as well as the UC Berkeley grad app, which is on the GradDiv website. Okay. So I know some folks tend to, or I should say some programs require the GRE as of fall 2024. So this past application cycle and beyond, the GRE is no longer required for UC Berkeley School of Public Health. It's optional. So if you've taken the GRE, and you've done well, and you want to include it on your application, you're more than welcome to do that. But we are not going to use GRE as a requirement for the listed programs. Okay, the only programs that we do require GRE are for the PhD in biostatistics. Okay, the MS or MA in biostatistics, and the concurrent degree program for the MBA and MPH. That's it. All the rest of the programs that we offer the GRE is optional. Okay. And if you don't submit your GRE, you're not going to be at any disadvantage. Okay. Especially if you have evidence of quantitative, verbal, or analytical abilities, such as if you've done research prior to applying to the program, if you have good grades in epidemiology or biostats, if you have experience working with statistical software such as R or Stata, if you have good grades in your math or statistics courses, or if you have writing samples such as published papers or other evidence that show strong writing ability, then obviously you're not going to be at any disadvantage if you don't have a GRE score. Okay. Okay, but if you do decide to take the GRE, make sure that you give yourself plenty of time to study. You can take it more than once. That's completely fine. We take your highest quantitative score. So just to let you know that we look for GRE scores within 5 years. So if you've taken it within 5 years, you're okay. At-home tests are allowed, and we look for applicants who score in the 50th percentile and above as competitive. Okay. And like I said, your 3 letters of recommendation are required when you submit your application. The best kind of mixture would be a combination of academic and professional references. Obviously, you want to ask for a positive letter of recommendation. No one wants to ask for a so-so or mediocre or negative letter. So really take take your time and be selective in who you ask to write your letter of recommendation for you. And when you ask for a letter of recommendation, don't just ask them, but send them your resume, send them copies of your essays, let them know what you're doing so that they can write a more full and detailed and multi-dimensional letter for you instead of just a very kind of run-of-the-mill letter that, you know, some people might write if they don't know much about you. Okay. And it is okay to have a TA or a professor co-write a letter as well. Okay. And when you submit your letter, you should make sure that it's written on letterhead and submitted through professional email. Typically, when you request a letter of recommendation, it's going to be through the application system. So it needs to be submitted through the application system as well. Okay. Now, obviously, you want to include your resume. Some folks may not have all that much experience, but you want to definitely include any educational degrees, employment experiences, skills, volunteer activities, publications you might have taken part in, any research or any leadership roles that can speak more to you as an applicant and create a full picture. Okay. Now, your statement of purpose, you want to really just highlight why you see Berkeley, why you've chosen the concentration you have, talk about your public health work experience if you have any, and how that relates to your goals. And you really want to make sure that you highlight your skills that you feel would serve you well, and make sure to have someone edit it, because we don't want to have any statements of purpose with any major typos or mistakes. Okay. And last but not least, your personal history statement, which is your story of you. You want to make sure that it's focused on you, that you talk about any obstacles or hardships that you faced getting to where you are right now. And you know, public health is personal, you know, so you really want to get personal and highlight why public health is where you want to pursue your degree. Okay. Again, writing samples for on-campus residential program. They can be a final paper from a class. They can be a report, a popular media article, a thesis. Any of these are, you know, very, very much acceptable for your writing samples if you choose to submit one. Okay. And we're kind of getting to the end, so I want to respect everyone's time. I know it's Friday, but I want to just kind of show everybody the cost of tuition for the different programs based off of whether or not you are a California resident, a non-resident, or an international student. So these are the this is the total cost of tuition after, you know, your program is said and done. Okay. So these are pretty much, I would say, competitive, especially with other public health schools. So, but if you have any questions, please feel free to reach out to SPH award at berkeley.edu, and we can answer any questions that you might have about scholarships or funding. Okay. This is the funding information for the last year. So typically our admitted students were able to receive around an average of about $19,000 in funding award. And in the end, their package offers were somewhere within the range of 4,000 and 53,000 based off of their financial need. Okay. About 40%, a little over 40% of our students were awarded funding when they came into their program. Okay. So I just wanted to highlight those. And we do have the Native American Opportunity Plan for those applicants that identify as a federally recognized part of a federally recognized Native American or American Indian or Alaska Native tribe. And so if that pertains to you, you'll definitely want to look into this funding opportunity. As well as, in addition to that, we also have the Blue Shield of California Fellowship, and this is typically awarded to underrepresented applicants that are part of the underrepresented groups, such as Black or African American students, Latinx or Latine students, Native American or Pacific Islander. Okay, and these grants are usually offered in the range of $10,000 to about 30,000 depending on financial need. Okay, so this is definitely something that you want to look into if you are part of any of the listed underrepresented programs. Okay, and these are some of the demographics for our online and on-campus programs. As you can see, excuse me, we typically, I was going to say, I shared this in order to kind of feed into the next slide, which is the dream office. And so for anyone who wants to contact the dream office for any questions about recruitment or retention or tutors or anything like that, you all will be able to contact the dream office. I'm sorry, I apologize. I know we're at time. We're at 6:32. So I want to be respectful of everyone's time here. But I did just want to highlight the Dream Office and how it focuses on recruitment. Like I said, recruitment and retention of historically excluded populations. Really, the Dream Office is here for these students, for you, not only just to recruit you, but also offer any type of assistance in studying. We offer tutors, retention specialists, and peer counselors and peer advisors as well. Okay, so, and last but not least, if you have any questions about admissions, make sure to email us. If you're looking at our on-campus, if you have any questions about our on-campus programs, make sure to email us at sphadmin@berkeley.edu. If you're interested in the online program, you can contact us at online.mph@berkeley.edu. If you have any funding or financial, I would say funding questions, sphawards@berkeley.edu is the email you want to connect with. If you're looking to talk to a current student, you can always email our current student ambassadors at sphgrads@berkeley.edu, or you can reach us at the Dream Office at sphdiversity@edu. Okay, and if anyone wants to take out their phones and just kind of, use the convenience of QR codes, you can stay connected with us through our website. Just go ahead and take a picture of this QR code and it will connect you to our website. Okay, I know we're at time, but if anyone has any questions, I am here to answer any questions that you might have, or try to answer some of the questions that you might have. So please go ahead and feel free to ask. I think we have one in our Q&A, and it says, can you please shed some light on the infectious disease and immunity and infectious disease and vaccinology programs? Yes, I can. Again, I just started in this position, so there's a couple. I'm still kind of in the middle of learning all the different concentrations and the kind of nitty-gritty details. So for, if anyone, I should say, if you are interested in, diseases, sickness, how, diseases get kind of, I guess you could say, transferred, or how they move about through the populations, and how, society tends to react and combat, any type of infectious diseases, or anything like that, then I would say that's kind of like what I, right now at this point in time, know the program to be. It's definitely very, very heavy on, if you're applying to the program, you'll definitely want to make sure that you are working to have very strong grades, especially in your math and sciences, because I've sat in on some of the admissions review sessions for IDI and IDV, and they definitely take a look at like, epidemiology, biology, biochemistry, statistics. So they definitely will look at your coursework and your performance in those courses if you are looking to apply to and are interested in IDI or IDV. But if you have any other questions, please don't hesitate to email our inbox with any questions. I'll put it again in the chat. I think we have a couple So it's SPH admit at berkeley.edu. So any questions, please feel free. Don't hesitate to reach out and ask us if you have any questions about any of our programs. Okay. And I know we're at time. We're a little bit past time, so I apologize.
Not a problem.
But I just want to say thank you. Thank you all for being so amazing and being so interactive on a Friday evening, on a dreary, rainy, wet Friday evening. You've made this fun for me. So
thank you again for coming. I'm actually right down the street from you, and I'm in Oakland.
Oh, okay.
And yes, it's been raining and fun, but thank you again. Actually, like I'm at work. I start work in a couple minutes. So.
Oh, okay.
But yeah, thanks everyone for coming, and thank you, Mr. Bynum, for giving us your Friday evening. And really appreciate you representing UC Berkeley School of Public Health.
My pleasure.
Thank you. And yeah, and I think if anybody has any questions, last